My name is Rebecca, and for the past year, I have focused on advancing epileptic seizure prediction using a machine learning-based wearable device. But first, here's a little bit more information about me. I'm a rising senior at Swan High School in Ohio. Academically, I have competed and received recognition at the national level in a variety of competitions, primarily being Science Olympiad, the National Junior Science and Humanities Symposium, and Future Problem Solvers. I'm also a varsity soccer player with 2 district championships. In my free time, I also serve as president of 2 clubs at my school, Green Team and Girls Who Code, where I've been able to lead initiatives at the intersection of environmental action and technology. From organizing community-wide recycling initiatives to teaching computer science fundamentals, I'm passionate about applying environmental engineering and computer science to build sustainable solutions. In the future, I hope to continue to expand on this intersection to build a greener future. So, what is epilepsy? Well, epilepsy is the 4th most common neurological disorder, and it affects 65 million people worldwide. Characterized by unpredictable, recurring seizures, epilepsy is more than a medical condition. It is a constant source of anxiety and danger for patients. It can lead to serious injuries, reduce the quality of life, and even cause a 3-fold increase in premature death. But the truth is, most current solutions aren't effective enough. For example, although anti-epileptic drugs are common, around 75% of people in low and middle income countries cannot access them, mainly because they're just too expensive. Specifically, some brand named ones have shown a nearly tripled cost over the last decade, now reaching up to $10,000 a year. And even for those who do have access, the treatment doesn't always work. And as a result, over 1 million patients still experience seizures despite being on treatment. Now, there is clinical EEG monitoring, which can help doctors diagnose epilepsy. But the issue is that clinical monitoring isn't practical for non-clinical, in-the-moment seizures. That brings us to the core challenge. Seizures are sudden. Whether it's driving, crossing the street, or even climbing the stairs, losing consciousness for just a few seconds can be devastating. And so I asked myself, what if we shifted our focus from treatment to prediction? What if we could at least give people a little bit of warning before a seizure strikes? And that's what led me to my project and my topic proposal, developing machine learning models that predict and detect seizures ahead of time, and integrating them into a wearable headset that sends early alerts, giving patients the power to take action before it's too late. So let's dive into my project. It can be summarized with these 3 main stages seen here on the slides. So first, to build my dataset, I sourced public EEG recordings from the CHB, MIT, and Siena Scalp EEG databases, which included over 1,000 hours of EEG data from patients 1.5 to 71 years old. After removing noise caused by muscle movements or blinking, I segmented the data into 20-second overlapping windows, called epochs, using the standard 1020 electrode system that you can see on the bottom right. Each segment was then labeled as either a seizure or a non-seizure. So to cover both detection and prediction, I trained and created a total of 5 machine learning models. For detection, I used 4 different models: k-nearest neighbors, logistic regression, random forest classifier, and support vector machine. While each of them have different approaches to binary classification, which can be seen in further detail here, in the end, they classify brainwave patterns as seizure or non-seizure. For seizure prediction, I decided to use a long short-term memory model, also known as an LSTM, which is a type of recurrent neural network designed for analyzing time series data, making it perfect for seizure prediction, I decided to use a long short-term memory model, also known as the LSTM for short, which is a type of recurrent neural network designed for analyzing time series data, making it well-suited for seizure prediction by learning patterns in EEG signals over time. So how did I do this? Well, a seizure can be broken down into 4 different stages, and I focused on the preictal stage, the time period just before a seizure. I then labeled the preictal epochs based on the prediction window that I created, and extracting time domain features that captured amplitude variation and frequency domain features that identified key oscillations. I was able to feed these features into the sequences that I created in my LSTM model, which tried to capture the relevant pre-seizure patterns. Then, to test my model performance, I split all of the data into 65% for training, 15% for validation, and 20% for testing. And for the results, they're here as shown. My K-nearest neighbors detection model achieved a 98% accuracy, and my LSTM prediction model achieved a 85% accuracy. The training graphs that you can see here show a steady improvement, indicating that the model was learning effectively and not just memorizing the data's answers. And so then once I trained my models, I needed a device. I decided to choose the Muse EEG headset, which was originally designed for meditation because it's lightweight, affordable, and it closely matches the electrode placements in my datasets. Using its Bluetooth capabilities, I streamed live EEG data to my models. If a seizure was predicted, an alert was sent through a web application that I built, which I'll show in a minute. I also integrated Twilio, which is a messaging platform, so that users could receive a text message alert either for themselves or for their designated caregiver. This is the app right here, and it allows users to enter their names, link their phone number or their caregivers, and record their live EEG signals. With just the press of a button, they are monitored in real time, receiving warnings if dangers are detected. So, although I couldn't test my models on actual patients, the system ran successfully on unseen data found from online and even my very own EEG signals, indicating its strong potential for real-world use. In the end, I exceeded my original goals, being able to achieve greater than 80% accuracy on both detection and prediction, predicting seizures up to 5 minutes ahead of time, and implementing them into models that are affordable and in a wearable device. And what this means is that just with a tap, users can go about their day with more confidence, knowing that they'll be warned before a seizure occurs. Even just a few minutes of warning can prevent a fall, a crash, or something far worse. That is the power of prediction. But this goes beyond epilepsy. What other conditions could we better manage if we focus on anticipating problems before they happen? Whether you're interested in AI, healthcare, or engineering, there's always room to innovate, room to ask the hard questions, and room to create something that has the potential to save lives. So I challenge all of you listening in the audience to look around your community, find a need, and ask, how can I use what I know to make a difference? Thank you so much for listening to me, and I hope you enjoyed my presentation. I would like to thank my parents for supporting and encouraging me all the time at all moments in this research project, and also for the contributors who helped create the datasets that I used for my project. Thank you again, and these are my references.